The primary recommendation made by the medical editor that I just told you about in the previous video was to reduce your intake of saturated fat. Now this is something we've all heard and we've all been told. You got to reduce your consumption of saturated fat because that's a primary factor in your risks for heart disease. Now, he's not doing the research, he's not reading the papers. You most likely don't have the access to get the information. You have to rely on information distributors to give you the information that you think you need to find out. And then, of course, you're not trained to evaluate what they're telling you. And they give their list of experts who tell you what you should eat and why you should eat it and what the science says. Now, here's a paper directly out of a scientific journal titled, I'll read it to you, you can't see it. Limited effect of dietary saturated fat on plasma saturated fat in the context of a low carbohydrate diet. And in the introduction to this paper, they tell us that saturated fat doesn't have anything to do with heart disease in the context of a low carbohydrate diet. Now that's a real revelation, because all the work that's been done over the years on saturated fat and its implications for cardiovascular disease has been in the context of the people following a supermarket diet. That's a diet that has carbohydrate in it, that has protein in it, that has fat in it. So they never took a look at what happens when you remove the carbohydrates. Well, that is only being done recently with the growth and the interest of the carbohydrate-restricted diet. Now, it turns out that in this particular study I'm looking at here, they used a carbohydrate-restricted diet, which doubled the amount of saturated fat that people were exposed to versus a carbohydrate-restricted diet that used monosaturated fats. So the saturated fat content got doubled. So you would certainly think there was an increased risk to cardiovascular disease. You would certainly think that there was an increase in the amount of saturated fat in the plasma. But the actual outcome is that there was less saturated fat in the plasma than there is on a typical diet. So clearly, the low carbohydrate diet, which was only 12% of total energy, which is right in the ballpark of my recommendations, led to lower levels of saturated fat in the blood. Now, the reason for this is that the low carbohydrate diet creates a metabolic environment in which the body begins to burn the fat that it's exposed to. So these low carbohydrate dieters are actually burning more fat, and that's why the plasma levels were low. Now, in the conclusions to this research, they argue that saturated fatty acids are often implicated in the worsening of insulin resistance, but the effect is contingent upon the presence of ample carbohydrate. Presence of carbohydrate. So now you're getting a look at what happens when you eat diets that are high in carbohydrate. Carbohydrate restriction in the presence of high saturated fat levels leads to improvement in insulin sensitivity despite increased lipolytic rates. That's the release of fat from the fat cell and the release of fatty acids into the circulation. So this then ends in an evaluation of current dietary recommendations, the ones I was talking about in the earlier video, that are made by the whole of the medical community, by our medical editor, by everybody in the government. And they're all based on the idea, the 50-year-old idea, that saturated fats and cholesterol are the cause of heart disease. So they write, the current findings further challenge the broad recommendation to restrict saturated fat, especially since those calories are likely to be replaced by carbohydrate, which has always been the way it's run. You cut your saturated fat intake down, or your total fat intake down, by going on a low-fat diet, and you replace those calories with carbohydrates. Not a good idea. Not a good idea. So, but you won't get this information anywhere else. because they're not reading this stuff. They got a vision, and they're reporting to you based on their vision, which isn't going to change. Very interesting that the final paragraph has a last sentence in it that says, persistence of recommendations in the face of continued failure of large clinical trials to show an effect of saturated fat remains one of the strange anomalies in current medical science. So we know that the saturated fat is not the cause of heart disease. That's been well spelled out. Yet the recommendations persist that saturated fat is a danger to us by all the major health organizations, despite the scientific facts that it is not. So you're going to have to really look into who you're going to listen to. And I'd suggest you stick with me, because I'm on the cutting edge of this thing every single day. And you want to be on the cutting edge too. I'm Dr. Greg Ellis.